My name is Dr. Amy Jelliffe. I'm a psychiatrist and board certified from the Psychiatric and Neurology Board. I've also completed yoga therapy certification when I reached a certain point in my practice as a psychiatrist in Arizona for over the past 20 years. I became very frustrated because there were so many skills that I felt my patients needed some support on in terms of eating and breathing and moving and cooking and sharing and supporting themselves. And there was so little time to really help develop skill building. So I started a group called Whole Health Recovery and provided that at the Guidance Center for several, maybe a year or so before I left. And that integrated practice, having a group where we practice guided meditation, drinking herbal tea and learning about the health properties. We were able to practice breathing and then share the experiences, which was very empowering, and also recipes. All kinds of good things happened when there was a chance to integrate these skills, as opposed to just sitting in the office one-on-one, talking about the medication often became the focus. So I did get the yoga therapy certification in order to incorporate this into my practice as a psychiatrist. And what I found was one of the most important things missing to help with the most common problems was breathing, education about how to breathe. And at the time, I didn't really know the importance of breathing, but I discovered it through really studying through yoga, the breath and why it's so important. And it's important to people who are emergency firefighters and EMTs. It's important to learn about the breath because it's the switch to calmness. It's the switch from the fight or flight response, which is the sympathetic nervous system, over to the parasympathetic nervous system, the calm response. So the switch is the breath. And so if we don't teach people and ourselves about the importance of the breath, and that we ourselves can switch it, we are the ones that need to be able to understand how to switch it so that we can calm ourselves down or get ourselves activated to mobilize and do what's necessary. So when you're breathing very fast, your heart rate is increased and your blood pressure shoots up, so that you can run, so that you can mobilize. And that can be associated with a lot of anxiety because you're basically in a survival mode on some level, whether it's chronically on a low level or a big level in order to escape a motor vehicle accident or something. If we switch with our breath to slow, deep breathing, then we lower our blood pressure and our heart rate immediately. Within 3 minutes, you can feel it. And a sense of calm comes into your body because you've switched the internal chemistry by changing your breath. You've switched the nervous system and the chemistry. So this is so important, and anxiety is such a common problem for all people. And I felt it was important to teach this first and foremost while we are at the beginning, so it doesn't get left out, because it's important. So I wanted to have a little time to practice breathing together, to actually have you look at an x-ray of the lungs, and you can see the heart in the middle and the diaphragm at the base and the ribs. And so here, I wanted to first have you see if you could just adjust your sitting so that you're sitting comfortable in your chair and you feel your tailbone balanced over the pelvis or in the middle of the pelvis, the middle of your chair, and let your spine rise up, elongating through the hips in the back and the neck, and tuck your chin slightly so that you're ready to breathe fully. The first breath we're going to practice is called the soft belly breath. And for about 3 minutes, you can use this any time of day, in the middle of work or while driving. And simply what we're going to try and experience is inhaling and exhaling in the nose, way down deep into the belly, like blowing up a balloon in your belly, sucking the air in and letting it drop down. So let's first just close your eyes for a moment here, so that you can pay attention to your breathing process. And just notice what it feels like for you to consciously breathe in and out, slow and deep, down into the belly area, expanding the diaphragm down. So a deep, slow inhale. And a very full exhale. Exhaling so that you push the air out of your belly and empty the torso. And then inhaling deeply again at your own pace. And exhale. And another full cycle. So that's a very simple beginning awareness practice of your breath called soft belly breathing, where you consciously inhale and exhale slowly. Now I wanted to break it down a little bit with you into 3 parts and have you first just put your hands up on your upper chest under the collarbones and inhale deeply and fully 3 times. And see if you can see or feel some lift in your upper chest with the inhale. You can inhale through the nose. Exhaling through the nose or mouth, whatever's comfortable for you. Good, so that can show you whether or not you feel an expansion upwards, just a rise in the upper chest. And then next we're going to take the fingers and place them on the ribs. So just right on the side of the ribs and inhale. Feel the ribs expand to the side, back and front, and then exhale, draw the ribs together as you exhale everything out. And inhaling. Exhaling. And one more time on your own. Good. And then we're going to try the third part of the torso that gets breathed into, and that's the low belly. So just take your hands and kind of cross them over the low belly here and do the same thing. Just close your eyes, take a deep breath in. See if you can relax those muscles and then use them to push the air out too. One more big inhale. And exhale. So by doing these 3 parts, it helps you to realize more the fullness of a breath that you can have when you consciously choose to breathe, to soothe yourself. So at night, if you're having trouble sleeping, or if you're at work and feeling anxious, you can place one hand on the upper chest and one hand on the low belly, like we just did. And let's do that for 3 breaths. Just feel the soothing quality of the 3-part breath, just filling the torso. Inhaling and exhaling. Inhale and exhale it all out. Make room for more. And then the last breath on your own. Good. So those are some breaths that I think are very helpful for the everyday anxiety that we get in the car, at work, or trying to sleep. And I wanted to up the training here a little bit because a lot of people here are involved in medicine or psychotherapy, and teach some tips for when people have panic attacks, which as a psychiatrist was one of the most common things I saw associated with anxiety. Was some people would escalate into a panic response, and the panic is triggered by hyperventilation, when people blow off too much of their carbon dioxide and they start to get tingly and dizzy and they feel like they're going to faint, they feel like they're going to die. And I had one of these in college and had no name for it, didn't know what happened, and I fainted on the student union floor. And it was the paramedics that came to help and explained it to me after I came to, that you can use a paper bag. You need to use something to re-infuse your body with more carbon dioxide. So you want to re-breathe your own air. And this is the key to treating panic. And I couldn't find one photo of it on the internet. So you can take a paper bag and place it over your mouth and over your nose too, mouth and nose. And you hold it close to your face and you inhale and exhale. Inhale and exhale. So that's why you hear about paper bags with panic disorder. But not everyone's walking around with a paper bag in their purse, and it's a little embarrassing to stand there in the grocery line with a paper bag. So you can use your hands and cup your hands over your nose and your mouth, and then bring the fingers and the palms together. Rest your thumbs on the jawbone, and you're going to breathe into your hands and then keep the air there and breathe it right back in. You're going to rebreathe your own air. So inhaling. Exhale. That's carbon dioxide in the hands now. Inhale it back in. Exhale. Keep it there and breathe it back in. Very slow and very deep. So that you flip the switch to the relaxed nervous system. So that's the kind of breathing that if you ever know someone who says, I'm starting to feel panicky, you want to realize they're breathing too fast and help them rebreathe their own air. You can just sit down on a chair and do this, and people think you're praying or something, or just kind of thinking. So if it doesn't work as well as you'd like it to, you can then really use the pauses between the inhale and the exhale to create an even more powerful response. So you would inhale, and we use counting when we teach breathing. The counting is by you. I'm going to do it first to kind of teach you how to do it if you haven't done this before. So we're going to inhale to a count of 4, and then pause and hold the breath in for 4. Exhale to 4, and pause again at the end, which is hard to do. But so we're just going to try it, and you can, if at any time, if you need to breathe, you breathe. So let's do this square breathing. It's very balanced and calming because it's a very controlled breath. So let's inhale to the count of 4. Inhaling, 2, 3, 4. Hold it, 2, 3, 4. Exhale, 2, 3, 4. Pause, 2, 3, 4. Big inhale, 2, 3, 4. Hold it in, 2, 3, 4. Exhale it all out. And pause. Hold it. 3, 4. One more deep inhale. And go ahead and close your eyes. Rest your hands on your upper chest for a moment and just feel your body. You may have thoughts of like, this is stupid, or I can't do this, or I don't know what she's talking about. But it is, I just want to prepare an intro to these concepts that are so helpful and so healing. And so I appreciate you just giving it a try. So the next breath is one that is called the emergency breath. And Dr. Andrew Weil down at the University of Tucson came up with this idea. He works in hospitals a lot, and sometimes people have a lot of pain or trauma. And so he came up with a breathing pattern of inhaling to 4, holding it a long time for 7 counts, and then exhale even longer, twice as long as the inhale, to 8. And then inhaling again, big, the 4. So I learned this and told my sister about it. And the very next day, she had a very painful medical procedure she needed to go through. And she did this the whole time. And she said, I'm so glad you told me, because I wouldn't have been able to handle it like I did. And so it works. And so I thought we would try it 2 times. It's not real easy, but when you're in a quiet mood and you want to practice it, I really advise you do, for that potential someday need to use it. So let's Just sit quietly, close your eyes. We're going to inhale big, 1, 2, 3, 4, and hold it. 2, 3, 4, 5, 6, 7, and exhale it all out. 3, 4, 5, 6, 7, 8, and inhale deep, full. 2, 3, 4. Good. Hold it. 2, 3, 4, 5, 6, 7, and exhale. 2, 3, 4, 5, 6, 7, 8, and then a big inhale. 2, 3, 4, and then rest your hands, bow your head for a moment. Just feel any response to that. It can be a feeling of, I just needed to breathe more, or it felt difficult to hold my breath that long. All of those are really normal responses to this. And so this is something you can practice just when you feel like practicing it. You get better and better at holding your breath, just like swimmers do. And being able to hold your breath and control it means you can switch from fight or flight to calm, to fight or flight to calm easily with confidence. And you can go to your doctor's office and get your blood pressure checked, and then you'll bring it down, and your pulse. So those are the breathing practices I felt were most important for me to present, in order to hopefully have you be able to use them in your life or your families or your patients. So the next thing that I felt was a basic self-care tool was to realize that you are your best healthcare provider, that you are your own best friend who knows the most about you than anyone else. And for you to really, when you're stressed or upset or grieving, that you really take yourself by the hand and think of yourself. What do I feel is best for myself right now? And our society has us think about our therapists and our doctors and our medication, and those are all essential components of care. But the thing that we don't talk enough about is how potent we are for ourselves, because of our own preferences, our own inclinations and gifts. So when you're needing stress reduction, definitely the breath you incorporate, but like the woman up on the left there, going outside and exercising, bringing her weights to feel strong, developing her muscles, or simply curling up in your bed or on your couch with a book, or going to sleep, or just crying. Those are things you ask yourself, what do I need now? It may be like the gentleman on the right who has just stepped outside to be quiet, to feel, to see what's happening in him, and to take in the nourishment around him, the sky, the sun, the wind, the smells of the grasses. And when you listen like that, you can notice that you can get very, very focused on the things that are wrong or that you're upset about, or you can open your focus even wider and wider and acknowledge your gifts and your talents and your successes in the context of this individual problem at that moment in the present. So really being able to shift your focus, widen it, and bring it small, so that you're able to balance and not overwhelm yourself. In addition to being your own best friend is the ability to be aware of this process that's predictable in all of us, which is that it is our thoughts that happen first, and then follow the feelings. And the feelings instantly create, and the thoughts and feelings instantly create chemical changes in our body. And these chemical changes can make us feel very anxious or very calm. And so when you're having anxious thoughts, you're creating a lot more adrenaline and cortisol, and your heart rate's going up. And so we need to become very aware of that. And that's called CBT, cognitive behavioral therapy. And you can be your own CBT support person. Like, wait a second, stop. What are my thoughts like? They're usually very repetitive, very conditioned, sometimes from our past, and very predictable. So, yep, here I am. I'm going over that little, mouse wheel again. And so I'm going to try to change how I'm thinking and feeling so that I feel better and take charge of this negativity. It can be as simple as thinking of the ocean, the last time you were at the ocean, or that you were at a lake or a creek and saw the water flowing and smelled the air and felt the flow of that, and be able to flow more in your own body, allowing things, the negativity, to move out. Sometimes thinking of 10 things or even 3 things that you're grateful for. Your ability to walk, your ability to go to a home, your cat that's sitting there waiting for you, the candle that's sitting in front of you, being a calming kind of anchor. So gratitude practice is very powerful for also quickly switching thoughts and feelings and internal chemistry by simply stopping and saying, I'm going to do this. This is what they say is helpful. We'll try it out. It is helpful. The woman on the lower right has taken herself outside and is enjoying the movement with her wheelchair. She's enjoying being outside in the weather and feeling the wind on her face. And that's another example of just quieting down, tuning in, and seeing what it is you'd like to do. Open the door. And in addition, being able to see the positive and the negative, being balanced in your perspective, moving your body like she's doing so that lymph and muscles all move, turning on music if that helps lift your mood, and even up in the upper corner here, I write, using your imagination. We all have incredible imaginations, but we don't use them a lot. And so sometimes just looking at the beauty of a shell that's on your desk and realizing the beauty of you as well, that we are all alive and we are all beautiful and we all have gifts and colors and skills to use to soothe ourselves and quiet down and feel good again. So that's a summary of some tools for CBT to practice. And we also all respond in a way to resilient activities, to activities with resilience. So there's certain things that you might do that wouldn't really help me feel a bounce back or a lift, but it might, when you discover what really works well for you, be the best tool to help you, support you during life. So what is it, like the woman on the upper left is cooking, and she is cooking with her daughter, and the man climbed into bed and is just getting the comfort of his pet, his cat. Someone else might sit down and say, I'm just going to do my watercolors and just let it all go. And the man on the left is smiling and happy to have his hands in the dirt and the plants and outside. So what are your supports and what are your favorites? And those are the things that build your resilience, your ability to bounce back pretty quickly. Food is the #1 medicine that we really need to take every day, and to be conscious of what that medicine is, because we're in charge of the choice of that medicine. So food is full of nutrients and healing properties. It affects our mind, our body, and our spirit. And I just want to see what I'm doing. Okay, so it affects our mind, our body, and our spirit. And just simply, I try to think of the most simple way to say this, that if you can eat so that you imagine that it's going to help you your whole life to live healthy, and to eat as simple a food as possible, not processed, not in boxes, as much as you can, but things that you just get from the earth, like an avocado, a berry from a cow or a chicken, or the nuts from the tree. So trying to follow these simple principles can sometimes help guide choices. And this next slide is the most complicated of them all, but I can simplify it by saying there's a kind of a mnemonic called the G bombs, which stand for the greens, beans, onions, mushrooms, berries, and seeds and nuts that are extremely nutrient dense, very, very powerfully healthy for your immune system, keeping away the colds and the flus and COVID, and helping boost your resilience against cancer. So I did outline what each of them, the G, the B, the O, the M, the BS, what all of those have that causes the nutrient density to be really full. So you can put all these together in a stew or a soup, or just on your plate on top of some chicken. It's very easy to utilize these, but it just takes remembering, like, these are actually really good for me. I'm going to add these on top. I'm going to add these in. And once you get in the habit of doing it, you continue to do it. So water is also important to move our blood and lymph, and you want to try to drink half your body's weight in ounces. So if you're 150 pounds, it's about 75 ounces. You can also take a lot of these things here, except for really the mushrooms and the beans, and put them into a smoothie. And it's up to your imagination what you want to put into your smoothie. You can look in your refrigerator. Is there some celery, a banana, some carrots, or berries, yogurt, greens? Really important. So try to whip something up in a blender and make it for 3 days, and just take some each day. And it's like a healthy elixir. So you can get yourself, if you make them twice a week, you can have them basically about 6 days a week. And then the next slide, I feel sort of sensitive about after the nutritionist talking about, the ways we talk about food that really is very, very much something we crave. It's really the foods to avoid. And it's foods that I call junk food because they're not nutrient dense. In fact, they're nutrients below zero. They actually challenge our body with inflammation and immune preoccupation, so that we wear out our immune system and our insulin trying to manage these foods that go into our body. So avoiding fried food, processed foods, and sugary foods, and realizing that sugar is very, very addictive. And so if we can try something like a piece of fruit, an orange, a date, a fig, some dark chocolate, it doesn't have quite the same addictive potential, and there's some nutrient benefits. Foods like these can cause inflammation, they can cause anxiety, insomnia, clogged arteries, and eventually all these different health problems that come from going repeatedly to the same kind of foods that don't have nutrient density. So the challenge here is to learn to monitor this opening here and your mind, because your mind's gonna say, I want that, and your mouth is gonna say, yeah, I do too. But you're the one who's gonna think through what you put in it. And so Gabor Mate is a physician who wrote a book called When the Body Says No. And so we have to listen in order to see when our body, after we eat, or even when we're thinking about eating it, when we realize this isn't good for me, and just saying no. Your body's working for you, with you all the time. So sit back, enjoy nature, enjoy your body, and let the sun shine on you when you're down. Breathe slow and deep. And I wish you well. I wish you health. And hopefully some of these self-care practices can be of benefit to you. So this is just a summary of my Yoga for Growth and Healing company that I have, that I work as a yoga therapist for health promotion, trying to teach these skills. And I also work for Blue Cross Blue Shield. But I am out of Santa Fe, New Mexico, so I'm available through that website. So take care, and thank you for attending. And if there are questions, Jeanette, let me know.
Hi, everyone. Well, we reached the end of the conference. I'm not seeing any questions for Amy. There's one. Let's see what we have here.
Thank you.
It was wonderful comment.
Good.
Thank you.
Good. I'm glad. I hope it's helpful, and I hope you can practice. And the counting may seem silly, but it actually helps you really assess yourself day by day. Like, oh my God, I got to breathe comfortably up to 7. That was amazing. So it's very encouraging and empowering. So I wish you all well. And thank you, Jeanette and Mario, for putting on this conference with the sponsors.
Thank you. And I do want to say that I've been through Dr. Jelliffe's session before as she was preparing, and I have been using her tips, and it's really been helping me with my anxiety. I guess I could have done a little bit more breathing earlier today.
Oh, I needed to breathe today.
But that brings us to the end of the conference, and I hope that you enjoyed all of our speakers and everything that we were able to accomplish. Thanks to our sponsors, Molina, Health Choice, and Arizona Complete Health, and also Maricopa Department of Health Services, who had a representative serve on our work group committee. I'm hoping that you all will give us some feedback. Let us know what presentations you would like to see for next year. and you should be getting an email with the evaluation in it. Please fill that out. It's important that we get your feedback to know how we're doing. Please put in some comments about any other resources that you're looking for, and we'll make sure we send you that link too. Have a great rest of your day. Have a great weekend, and see you next year. Thanks, everyone.